My name is Beth Vale. I'm an applied anthropologist and co-lead at Percept, a transdisciplinary social impact advisory firm that is rooted in South Africa, but has an international network of partners and clients working towards a healthier, more resilient world. Central to Percept's organizational culture is an intuition that is also core to anthropology, that human action and relationships are born out of a social ecology. This means that the ability of each of us to show up as whole people, to develop strong and enduring professional relationships, and to do our best work is dependent on an environment that nurtures this. Percept is a deliberately small collaborative team. We reject the hierarchies and shareholder extraction that often characterize corporate culture, but also the bureaucracy and martyrdom that pervades NPO culture, and instead aim to model the mutually cooperative society we'd like to see. I'll discuss 3 other tenets of anthropology and how we have mobilized them in our healthcare consulting. The first is the emic perspective, which is to read the world from the insider's point of view. That means getting to grips with how people make sense of health and illness, as well as the social, political, and cultural stakes involved in healthcare and health seeking. Without an understanding of the ways that health interventions are interpreted, remade, and resisted by those who are expected to use or deliver them, our efforts to advance human health go to waste. We also risk sidelining the expertise of healthcare workers and people living with illness who have amassed critical embodied knowledge of how health is made or broken. Percept co-leads a Global South collaborative that seeks to advance value-based maternal health care by foregrounding an emic perspective. Value-based care involves working with providers, governments, and insurers to fundamentally reorganize healthcare delivery and financing around metrics that matter to pregnant women and mothers. Through anthropologically attuned research, we have sought to understand how women in different contexts experience maternal health care, what they value in their healthcare providers, and what quality of life means to them. Each of these self-reported measures has implications for how women engage healthcare, as well as their own and their child's long-term well-being. Informed by an emic perspective, we are co-creating context-specific, implementable sets of patient-reported outcome measures to evaluate and iteratively improve maternal health care. In another project, Percept undertook a Gates-funded telehealth pilot among patients with uncontrolled sugar levels. Participants received 3 months of telephonic glucose monitoring and psychosocial support. Some commentators have celebrated telehealth for supporting self-management. Others have condemned the extended reach of surveillance and the medical gaze. But what was the emic perspective? Our qualitative research showed that despite being in person, public healthcare services were often inhuman, with little person-to-person connection. Health workers had time scarcity, while health seekers spent full days in queues. The result was a long wait, followed by a hurried consultation. Participants described how phone calls from their doctor unsettled the provider-patient hierarchy. There was less assertion of health worker authority, more attention to the person, not just the patient, and greater reciprocity in conversation. The pilot achieved a significant 2 to 4% reduction in HbA1c levels. The second tenet is holism. For anthropologists, making sense of health behavior and health outcomes means locating them within the wider social context in which they are produced. This is in stark contrast to the biomedical model, in which the individual is the locus of diagnosis and intervention and is expected to take responsibility for fixing their own health. Anthropologists can help articulate the social, cultural, environmental, and economic systems that shape human health, illustrating that no one's health is made in isolation. Holism informed Percept's work on medico-legal claims for cerebral palsy, or CP. South Africa has had a substantial rise in claims where CP is a direct result of negligent care during pregnancy and birth. While improving healthcare quality, government must also cost medico-legal payouts in a way that is both just for claimants and cost-effective for the public health budget. Through a series of interviews with parents and guardians of children with CP, we were able to bring into focus the costs and contexts of CP caregiving, which extend beyond the child to their families. Caregivers of children with CP can struggle to earn an income, experience physical and mental health challenges, and become targets of stigma. Caregivers that receive a medico-legal payout are often encouraged to move to the suburbs where they'll be closer to health services. But in the process, many lose community support and struggle with inflated costs of living. Current claims processes do not factor the changing needs of families caring for children with CP, restricting budget to the narrowly defined needs of the child. Since the well-being of children and caregivers is tied, it's imperative that they receive a more holistic package of support. If a holistic emic perspective is anthropology's theoretical orientation, storytelling is its method. Asking what the human story is, how its pieces fit together, and what larger meaning can be made of it is foundational to how anthropologists gather, construct, analyze, and communicate data. Through storytelling, we can translate austere technical problems into digestible narratives that ignite empathy and action. In a series of briefs on non-communicable diseases in South Africa, Percept combined actuarial analysis with ethnographic vignettes. While quantitative analysis illustrated the extent of need and the pace of change over time, the vignette showed how this reality was playing out in homes and communities as a reflection of life conditions rather than lifestyles. Finally, Percept's thriving rests on approaching our clients with some level of ethnographic intuition, treating clients as experts of their own experience, moving with humility and reflexivity, and coming to an understanding of their values and interests.